Hello, this is Dr. Mario Martinez, also known as your house shrink. I'm at house shrink is my handle here on TikTok. And those of you who follow my work know that I do these presentations on particular issues that are important to people. I talked about depression on the most recent, and today, well, actually, I talked about many other things, but today I'm going to be talking all about depression, everything that has to do with depression. But I want to tell you from the beginning that I'm not diagnosing or giving any kind of clinical advice, because that would be unethical, because I don't know you. And what I'm going to be doing is just giving you general ideas about depression. The last one of the most recent was about anxiety, all about anxiety. This one's going to be about depression, to identify the symptoms, to look at what the possible causes are, how to identify clinical depression from a regular depression. So if you just joined, welcome. And I'm going to be talking today all about depression. I'm a clinical psychologist, and I've worked in private practice for many years, and also in hospitals, and now I do mentoring and consultations. So today, it's your time to come in and learn all about depression, without diagnosing you or trying to give you any advice, because again, that would be unethical. You have to have professional advice, and this is not to take the place. I'm going to drink some water now. As people are coming in, welcome everybody. Every time we have these live streams, I have several thousand people. At the end, they give you the cumulative amount of people who actually viewed, several thousands, which is really nice. So today, we're going to have something that I think you're going to like, in addition to the talking all about depression. But the first thing that I want you to do, hi everybody, people are saying hello, hi. The first thing that I want you to do is to follow my work. Click follow, because that's how I can reach more people, and it allows me to be able to get more people involved in this, but also you'll know when I'm doing a live streaming, and you'll be able to join. So please follow, and if you're already following, then what you need to do is just, Carmen just followed, wonderful. All you need to do, if you're following already, share, and also let other people know. Now, as you know, those of you who have followed me, this video is going to be longer than 60 seconds, and I have that capability now because of the amount of followers that I have. You know, you're only allowed 60 seconds, but we get a certain amount of followers, then you're able to do more. So it's a lot of benefits to you. So since I won't be able to post it here because it's only 60 seconds, TikTok allows me to then download it to my social media, and in my case it would be YouTube, and you'll be able to go there under Dr. Martinez, and you'll be able to watch the whole video, okay? Now, the wonderful thing we have, when I'm doing these presentations, we always have what I call the clowns, the people who interfere, and they try to be cute, they try to be funny. They're not interested in anything serious. They just want to be clowns. So what we're developing now, we have Samantha as a moderator. So what we're going to have now is clown warning. A clown warning is when you clown around, you'll be given a clown warning. You do it again, you'll be muted. And if you're obnoxious or if you're doing something inappropriate, then you would be blocked. So again, be aware of the clown warnings, because if you're getting a clown warning the second time you do it, you're muted. And the reason for that is because we want people to respect you. You're an intelligent, brilliant, wonderful audience who wants to gather information here, who wants to see more than dogs fighting or pretty girls shaking their butts. What we're going to shake here is your brain. That's what we're going to do. So I'll be talking about depression, and I'll be answering some of your questions, but make sure that you're serious about this, because remember, we have a clown warning, and if you get a clown warning, that means the next time, boom, you go. So you see already starting, people, somebody here got a clown warning already, the Charger 35. We're not talking about Corvettes, we're talking about depression. So stay tuned. That's one of the problems that you have with social media. People just don't know how to focus. They don't know how to get in tune with what thing. They're all over the place, multitasking and trying to be funny. So remember, got a clown warning there already. So the topic is going to be all about depression. So I'm waiting for people to come in so I can get started and not leave people out. But remember, if you don't get all of the information here, it'll be tomorrow. It'll be completely downloaded to my YouTube channel, which is Dr. Mario Martinez. While we're waiting for people, I ask you to follow the host. Very important. You'll be having questions. How do I get out of my own mind? Well, you can't get out of your mind. It's your mind. There's some techniques that I'll be talking about. But again, this does not replace psychotherapy. This is my opinions, and I'm not diagnosing or giving you any therapeutic advice. I'm just giving you general information because it's unethical as a clinical psychologist for me to diagnose over live streaming. So that's not going to happen. But I will give you some ideas, some things you can do when you see your professional. I feel we all have depression, just on different levels. No, not everyone has depressions. Some people have, well, I'll explain later. There's a clinical depression, and there is a depression that's affective. It's a clinical depression. So first, let's start to identify it. The low serotonin level, I'll be talking about that. I'll be discussing everything from the physiological, neuropsychological, the biochemical, the cognitive, and the behavioral. So give me a little time and I'll be talking about that. But while we're waiting for people to show up, and it's exploding with people coming in, make sure that you follow the host. Make sure that you follow the host. That's your ticket in. So we're seeing some people here that are regulars, and it's really very nice. And I think the clown warning is working out really well, because then you know that if you get a clown warning and you keep disrupting, you'll be muted or you'll be banned. And the reason, again, is because this is your time. So I have to respect your time. Let's see. Somebody said here, I believe that depression is caused, let me see if I can get this out of here. I lost that. Let me see if I can get it back. I believe that depression is caused through bad habits in early childhood as well as the choice. Let me clarify. Depression is not just one thing. We're too complex to be able to reduce things to one thing, to genetics or serotonin or bad habits. It's a complexity of things that I'll try to clarify here for you. So these are questions, but what I'm going to give you is the science of depression as we know it from medicine and psychology, psychiatry, and neuroscience. I'm a neuropsychologist, and I've dealt with thousands of depressions, clinical and not clinical. So let me start identifying. For those of you who just joined, please, the first thing to do is follow the host, as user 399 did, and many of you have. The reason, number one, so you'll be notified, or you'll know when I'm on and you can follow my work. And two, I can reach more people, and I can do these kinds of things with more and more people and hopefully benefit. So let's start identifying the theories on depression. Okay. The prevalent theory in depression is a lower level of serotonin. Serotonin is a neurotransmitter, as the dopamine and other kinds of neurotransmitters. And the theory is that if the neurotransmitter of serotonin drops, and that happens because from one connection to the other, when you're having the connection of neurons, it sends serotonin to one side and then it reuptakes it so that it doesn't overload it. What happens, the theory of depression, is that there's a problem there and the serotonin drops. So then the medication drops the reuptake, which means then that the serotonin goes up. That's a theory. When you go to the doctor and they give you antidepressants, they never check your serotonin because it's extremely difficult and very expensive. So it's just clinically. There are also other theories, which I'm more in tune with, is that inflammation has to do with depression too. Clinical depression has to do with it too. So it's an inflammation, could be serotonin. Some medications will work on serotonin, others will work on dopamine. But it's a combination of the idea that there's some kind of neurotransmitter issue. I think it's a lot more than that. And the clinical depression has symptoms that people will the professionals will diagnose. They look, for example, at what's called the vegetative signs. And the vegetative signs are energy level, libido, sexual interest, energy, appetite, and sleep disorder, as well as the affect and the emotions. So that is the clinical interpretation. So when you go to a doctor and they'll ask you those questions, and then if you have some symptoms of that, then they'll say, okay, this is a clinical depression. Now the problem with that is that you may have a depression which is what we call appropriate to the circumstances. If your mother dies and you don't get depressed, you're a sociopath, right? Because I mean, your mother died, and you could be sad. Depression is a lot more than sadness. You can be sad, appropriately sad, because you lost someone in your life, or something is happening to you. You have an illness, so do you think that diet and gut health are linked to depression? They're contributing factors. But again, what I want you to know is to get away from the one symptom, one cause. It doesn't work that way. It's a lot more. And that's what I'm going to be trying to unfold over here. So many things have to do with it. But let's stay with the depression. I said clinical depression, what it is, the diagnostics and so forth. And of course, so there's some cognitive tests that you can take. They ask you questions. Are you sleeping well? Do you feel like life is worth it? Those kind of things. And some clinical depressions will have suicidal tendencies, and others don't. So that's one of the conditions. Now, a depression appropriate to circumstances, as I mentioned, a loss of a family, an illness, chronic pain, all those things are appropriate to a circumstance. It means that you're a human being, and if you lose someone, then you're going to get depressed, or you're going to have the sadness. That is appropriate. In many cases, it doesn't need to be treated with medication, but that's up to your professional mental health person and you, not me. I'm just giving you some ideas in general, but don't apply them to you without professional help. I can't overemphasize that. So you have the clinical depression and you have the situational depression. The situational depression usually goes away after you mourn the person, or after you change the conditions, after the pain goes away, or whatever it is. The clinical depressions usually don't go away by themselves. Some do, but some don't, and some require some intervention, either psychotherapy or psychotropics, or a combination of the two. Psychotropics are medication that affect your psyche, including antidepressants, antipsychotic. Now, you can have a depression without psychotic symptoms, which means that you're depressed, your affect is depressed, your appetite has been affected, but you're not having any kind of psychotic symptoms like delusions and hallucinations and things like that. Some depressions come with psychosis and depression, which means that not only is the person depressed, but they're having hallucinations, either auditory or visual or sensorial or whatever, of the five senses. That would be a psychotic, and usually that's treated with antipsychotic medication and antidepressants, depending on the practitioner. So those are the general ideas. Now, you can be sad without having to be clinical depressed. You get a little sad. You start having some memories about the past, and you start thinking about the bad things that happened in your life, and you start feeling the sadness, and you start feeling a melancholic feeling. Melancholia is not used anymore in the DSM, and it should, because it's a really good term. It's a sense of sadness. It's a sense of lowering your affect. That doesn't necessarily mean that it's depression. Is there any side effects to Lexapro? All medications have side effects. And what you have to do is you have to read the labels and see what the side effects are. And that's what in medicine is called the risk-benefit factor. You look at the risk from the side effects and so forth, and you look at the benefits. If the benefits outweigh the risks, then usually the doctors will prescribe it. If they don't, they'll either tell you, look, this is going to be dangerous because it could affect you, but we need it because you're suicidal, for example. So it always has to do with the risk-benefit factor. But there's no such thing as a medication without side effects. The reason is that we have receptors all over. You have receptors for serotonin all over. And when you give an antidepressant for serotonin related, it's going to affect serotonin that you have even in your digestive system. You have serotonin all over. That's why sometimes people have the side effects of dry mouth, or they have constipation, because it's affecting many of the receptors of serotonin. So if you just joined, the first thing to do is to follow the host, like Maggie did, and everyone else has been doing it. So follow the host. And then second, If you've already followed the host, then make sure that you share this information and that you let people know that the house shrink is on and that you can go and follow my work. If you just started and you lost some part of the video, not to worry. Tomorrow you can go to my YouTube channel under Dr. Mario Martinez, and it'll be there. So you can watch the whole thing. It'll be in the section of TikTok, which is the Getting Your Life in Order. So my channel, YouTube channel is Dr. Mario Martinez. So Dr. Mario Martinez, you can go there. And when you go there, I also ask you to please follow the work. I've had over 500,000 people already visit, and I have about 200 videos, all kinds of information, relationships, self-esteem, depression, anxiety, all kinds of things. So it's really very good that you can go there. Okay, now let's see over here. Last September, October, I was given antidepressant. Doc thought it depression. I can't answer that because I don't have your clinical history. So those kind of specific questions I can't really answer for you to be ethical because I don't know your situation. So you have to discuss that with your professional, psychiatrist or whoever you're working with, and then you can actually work that out. Can anxiety give you delusions? No. Unless you have a psychotic condition, anxiety will not give you delusions. Delusions are a psychotic process. Anxiety is just a level of tension that has nothing to do with delusion. So they're unrelated unless there is a problem with a psychosis. PTSD and anxiety, they played around by the way, anxiety and PTSD can cause a depression because depression means that you don't like what's going on. It makes you sad. Your affect becomes flat. And of course, you're going to have a reaction to it. So this is why depression or any kind of human problem cannot be treated with just one thing. We're too complex to say this is what's causing it. It's always a multitude of things. Now, when you get depressed, one of the things that happens is that since you lose your appetite and your affect becomes flat and you don't sleep very well, there's a tendency that the only thing that actually tastes good is a lot of fat and sugars. So you have to be careful because that's what your gustatory senses will pick up on junk food and sugar. So be aware of that and be aware that some people gain weight when they get depressed. And also be aware that alcohol can make the depression worse. Any kind of drug can make the depression worse. Alcohol is a central nervous system suppressant, so you don't want to suppress your nervous system more than you want to. What about fear? Okay, yesterday I talked about fear. So Mary, go to the live stream is up already on my YouTube channel, Dr. Mario Martinez. You can go there so I can stay on task, but also give you something for you to work on. It's over about an hour on fear, so you can go there. What type of treatment is used for seasonal affective disorder? It's called SAD. The acronym is SAD. And the theory is that if you don't have enough light, the pineal gland will not secrete the kinds of chemicals that you need, and you can go into a clinical depression. Many countries, for example, in the Nordic countries, have seasonal depression because they don't get a lot of sun. They have a depletion of vitamin D, which you get vitamin D with the sun. You synthesize vitamin D with the sun. So then the treatment is that they sometimes use a special light, and you sit in front of that light for a period of time, and it helps with the SAD, or seasonal affective disorder. Melatonin is what's involved in the problem with it. So a drop in light sometimes affects the melatonin, and then melatonin affects your sleep, and you can actually get depressed because you don't sleep enough. Okay, now I'll keep going as you got here. This is House Shrink, also Dr. Mario Martinez. And what I want you to do is to follow the host like most wonderful people are doing here. Then if you haven't seen the whole thing here, you came in late, it'll be up tomorrow in its entirety, my YouTube channel, and the YouTube channel is Dr. Mario Martinez. Okay, so if you have any questions, I'll stop, and if they're serious questions, I'll answer them. I think it's working really well, what we're doing here. What do you recommend I do to do? I've done programs and stopped for a little, but you got to be more specific on Firebee. You got to be more specific on what you're asking because it's too general. I'm not sure what you're saying. So following the host, love heals. Just follow the host. Hey, Napoleon, I couldn't make it out. Make sure that you follow the host. Everybody that comes in, the first thing to do, follow the host, follow the host. Because that will let you know when I'm doing these live presentations, but also it'll allow me to reach more people. It's the whole idea, to try to help as much as I can as a clinical psychologist, not to diagnose or to treat, but to give you general information so then you can get professional help or you can read my books, The Mind Body Code, The Mind Body Self. They're both bestsellers, and you can get them on Amazon. And when you go to my channel, House Shrink, you'll see there the two names of the books, and you'll see a link to my website. And by the way, I do a monthly group called Healing the Wounded Hero that's only open for about 14 people. And so if you want to join, there's a cost to it. If you want to join, you go ahead and sign up because a lot of people will try to sign up for it. Can depression cause general confusion in everyday life? Yes, because depression, you're so aware of what's going on with you that it doesn't allow you to really see what's going on outside of the world. And depression can also, sometimes people get accident prone because they're not really paying attention. They're so involved with their pain and their sadness or their lack of sleep or their affect that they don't really tune into the world. So yeah, it can affect you very much. How do you feel about supplements? What about, well, here's what you have to be careful. Number one, any kind of supplement or any kind of that you take, just because it's a supplement doesn't mean that it's good. Just because it's organic, it doesn't mean that it's good. There are a lot of organic poisons that will kill you. So it's very, very important that you talk to your professional mental health person before you take anything. Before you take anything, because a lot of those things that are sold, they're not FDA approved. You don't know how it's going to be. There's a type of natural, as they call it, or an organic herb that you take for depression, and it's very dangerous because it can have an effect on your blood pressure. So you always have to be careful. Remember, your body is your temple. You have to be very sensitive to your body. So become very aware before you put anything in your body. They're going to try to sell you a lot of snake oil out there, but always consult with professionals who know what's going on, and then again, get their information, but you also become well informed. The whole idea is for you to become well informed. Follow the host. Very good. A lot of people, native is following the host, and curse them embodiment has all follow the host. So the first thing to do, if you just join, follow the host. That's the ticket in. And I will continue to talk about depression, all about depression. Another thing that happens with depression is that it says it runs in the family. Well, running in the family doesn't mean it's a sentence. It doesn't mean that it's a genetic sentence. It means there's a propensity for the depression. And you can do a lot about that propensity and not to be expressed by the way you live. What are the good things for depression? Eating well, working out, meditation, allowing yourself to get out of yourself and see if you can do things for other people, and many other things. And they're in my books, The Mind Body Code, The Mind Body Self. I'm just giving you tidbits here, but if you really want to get into it, my books, The Mind Body Self, The Mind Body Code, I talk all about that and how to actually change your life so that you can become a wellness conscious person. I know chronic pain can cause depression. Of course, does chronic pain disrupt the brain chemical serotonin? Well, chronic pain can, but here's how chronic pain works. Chronic pain works on the pain receptors. And it can be from an injury, it can be from surgery, it can be from other kinds of illness or secondary effects from other illnesses. So what happens is that you become depressed because of the pain. The quality of life goes down. You don't sleep well, so that affects your depression. You don't eat well because you're hurting so much, so all of that affects the depression. And it may not be necessarily related to serotonin. It can and cannot be, but I think pain itself will determine that. Am I a doctor? Yes, I'm a clinical psychologist, a clinical neuropsychologist, and my specialty is how thoughts and emotions affect the nervous, immune, and endocrine system, and it's called psychoneuroimmunology. So, okay. So make sure that you follow the host. Very important. And I'll continue to go. That's the ticket here. Follow the host. So if you have any other, K baby following the host. Very nice. Very nice. The first thing you do is follow the host and then join me for two reasons. One, because I can expand the audience. And two, because you'll be aware when I do these live presentations and you'll be able to join. So I could be your test subject about depression. Is depression lifelong or can it be situational? It can be both. I talked about it earlier, but let me clarify. Depression can be situational. As I mentioned, the death of a family, the death of a friend, an illness can make you depressed. And that is a functional thing. You're a human being and something bad happens, so it's going to be affecting your affect, your emotions. And then after a while, it clears out. There's depressions that come out of the blue. The clinical depressions usually just come out, everything's going well, and boom, you have all these problems with affect and appetite and libido and energy and your hope for the future and suicidal ideation. It depends. What do you think about the body keeps a score? Are you talking about Gabor Mate? Or I'm not sure who you're talking about. But yeah, the body keeps a score, but it's not the body. It's the mind-body that keeps a score. But things can be reversed. Can PTSD, anxiety, and depression affect the brain? Well, yeah, they're affecting the brain. This is why you're having these conditions. Everything that's happening can affect your brain. And yeah, I know it's a book, but who says it? Is it Gabor Mate or who else? Whatever it is, it's good. The body keeps a score. I would add the mind, body, and the context keeps a score. The mind, body, context keeps a score, meaning that things happen in a context. And sometimes you walk into a place and all of a sudden you feel sad or angry or happy because that context reminded you of a condition in the past where you were happy, sad, or angry or whatever. So be aware, look at the context. The first thing you need to do when there's a mood change, ask yourself, what is this context? What is this reminding me of? And what is it that I need to do about it to be aware that this is a contextual thing happening here? Can you explain when your thoughts become feelings? Well, your thoughts and feelings are always there. It's just that you become aware of one or the other. A thought has a very low level feeling or a very high level feeling, but thoughts and emotions are very interrelated. It was thought that the cortex had very little to do with emotions and that emotions were more in the area of the amygdala and the limbic system. It's not like that at all. Cortex and the limbic system interact with each other. So there's affect in the cortex too, meaning that the interpretation is there. So it's really a combination of mind-body. Do you think that Xanax taking for a long time will have consequences? In general, I can speak. I can't speak for you. I can't speak for you because you have to go to your professional, and it would be unethical for me to tell you. In general, any medication that's for situational kinds of things, if you take it for a long time, it can have a negative effect. But this is something that you need to discuss with your professional. Also, some of these medications, even though they're not addictive, they cause dependency, and you just don't want to stop them. You always do it with professional help. Because if you stop a medication, even if it's not addictive and it has a dependency, you can have some problems with it. So it always has to be done with professional help. I cannot overemphasize how important it is to get professional help. Are there any foods that can actually regulate chemicals in the brain? Well, I can give you some of the foods that irregulate chemicals in the brain. A lot of sugar, the sodas, a lot of the refined carbohydrates. They affect the sugar. They affect what's called the glycemic index, and that also can affect your brain. And too much sugar can cause all kinds of problems. It can kick in the family propensity for, let's say, diabetes type 2 or even heart problems. So the food is very important. The food that you eat is very important. You want to cut out. I can't remember how long it's been since I've had a soda drink, a Coke or Pepsi or whatever. Even the diet drinks, by the way, are terrible for you. They don't do anything for your appetite. They actually increase your appetite and toxify your liver. So be aware of that. I've seen people at a restaurant who are obese, and they'll order this and that and that. Oh, by the way, I'll have a Diet Coke. It's not going to do anything for you. It's going to be worse because it's got over 500 chemicals. And even though they say that there's no sugar, there's artificial, and that confuses the liver. So it causes all kinds of problems. So get away from sodas. Drink water or drink wine if you can. So yes, there's some foods that can really affect your affect, your emotions. You imagine if you eat a donut in the morning and you have a Coke. What have you done? Your glycemic index has gone all the way up there. So there has to be a burning. A lot of insulin needs to be. So you're under-regulating and deregulating the system. So what can happen? You could have brain fog. You can be hyperactive. Your blood pressure could go up. All kinds of things just by putting junk into your system. So that's very important for you to be able to see. And a lot of times, just by learning how to eat the right food and working out, it can take 90% of the problem. Monique, hey, how are you, Monique? Monique is a regular here, and just want to welcome you. So if you just joined, the first thing to do is follow the host. Second, if you're already following the host, click the share, and then let people know. And then go to my YouTube tomorrow, so you can watch this whole streaming here, and it'll be available for you tomorrow. You can go today and see other things, but this will be available tomorrow. And the name of the of YouTube, my channel is Dr. Mario Martinez. Very simple. Just go there. Over 500,000 views already. So it's really very popular because of the information that I'm sharing with you. I'm a clinical neuropsychologist. I'm a licensed psychologist, and I specialize in how thoughts and emotions affect the nervous, immune, and endocrine system, and also how cultures will also teach you how to get depressed. And in some cultures, depression is not acceptable, so you have to hide it. So cultures can have quite an effect on depression, especially some men are not supposed to be depressed and things like that. And those things are terrible because you're having some internal problems and you can't share them with anybody. So it's very important to see that you have to take care of yourself and be aware of how the culture is suppressing you. So anyway, any other questions here as we're moving along? If you just joined, I'm talking about the subject is all about depression. Clinical depression, situational depression, sadness versus depression, and everything else that you might want to ask about. So be aware and follow the host, number one, and after you have, click share, and then tomorrow you can go to my YouTube channel and watch this whole streaming on Dr. Mario Martinez. I had depression, anxiety, PTSD, and with dieting and exercising, I stopped the meds. Wonderful. Congratulations. That's really very good. A lot of times you can do it, and sometimes you can't. But I think this is really good that you did it. You're a success story, and it's wonderful to hear. Many people in the U.S. still see depression as a weakness. Yes, that's right. It's seen as it has nothing to do with a weakness. It has to do with your neurochemistry, and it has to do with your way of looking at the world, what you learn about your life as a culture. So it has nothing to do with weakness. It has to do with, for example, you see how cultures do things. If, for example, you have a toothache, you're not weak because you go to the dentist. But if you have a depression, then you're weak because you go to a doctor. See how cultural it is? It makes no sense. So you have to walk away from the culture and take care of your own needs. How do you feel about natural supplements? I talked about before, but I'll mention it again. Supplements, because they're natural, doesn't mean that they're good. You always have to check with your professionals who know the biochemistry. Some supplements are good, some are not good. What is the best way to get supplements? In your food. The body accepts things in the most natural, most precursor. For example, a protein is made out of amino acid chains, and you want to get not the protein drink or whatever, you want to get the food that triggers the amino acid string to create the protein. So don't juicing and not eating much sugar. Yeah, I don't eat any sugar at all. You got sugar already. You can get you can get all kinds of things with the taste of food. Juicing is good, but you got to look at what you're doing with your juicing, what you're putting in it. You don't want to put any sugar. You don't want to put anything that's not natural. And also, it's important that you combine fruit and for example, some proteins like almonds and some kind of nuts in it. Isn't sugar in everything? Yes, in most everything, but you have different kinds of sugar. Sucrose, lactose, different kinds of sugar, glycogen, many kinds. And the refined sugars are the ones that are a problem. And fructose, for example, is the sugar in a fruit, which is absorbed a lot better than if you take refined sugar. So there are sugars, and there's some good sugars and some bad sugars. The more refined, the worse, because the glycemic index goes right up, and it's not good for you to have those imbalances of sugar. And it can actually trigger family propensities for diabetes and other kinds of problems. It's like chapter 3 in My Body Code, the immune system. Everything is connected to maintain health. Yes, the body and the mind try incessantly to stay healthy. So it's very important that you're aware of that rather than looking for illness, it's looking for wellness, but it needs help. I make turmeric, ginger, organic coconut water, and pepper. Yes, all of those things are anti-inflammatories, by the way. Turmeric, ginger are anti-inflammatory, which means it reduces the general inflammatory that you may be causing by other things. When I'm depressed, I tend to overeat, trying to get some dopamine from foods. No, you're not trying to get dopamine from foods. What you're doing is that I mentioned it earlier. When you're depressed, your gustatory sense drops. You're not as sensitive. And the most sensitive parts of your gustatory sense in your tongue is the junk food and sugar. And the junk food and sugar, when you eat them, it triggers dopamine. So dopamine is not in the food. The dopamine is the response, the positive or the euphoric response is what's happening. So the food is not the dopamine. It's the food that triggers the dopamine, but it's in a bad way. And that's what happens with addictions and compulsions and so forth. I think you have to be careful with iodine. You have to be careful with everything, because just because you're told that iodine is good, you don't want to take iodine. Or you have to see if you have a deficiency, and you can have blood tests that will tell you if you have deficiency. But iodine is very low in the natural foods. Like 100 years ago, there was proper iodine, and now it's very low. But it doesn't mean you need to take iodine. You need to take food that is rich in iodine. That's the way that when I'm depressed, I hide away. Yes, a lot of people do that. And what you want to do is you want to take time for yourself. Go inward, go to the cave, but don't spend too much time there. You have to go back and be pro-social, to be with people. Not to talk about your depression, but to be with people is also very important, because being with people actually increases oxytocin, which is a very good neurotransmitter hormone that is helpful for your general state of being. So it's very important. You need time for yourself, but don't stay in the cave too long. You need to go back, because we're pro-social beings. And the more time you spend by yourself, the more depressed you can get. So everything has to be balanced. If you just joined, the first thing to do is follow the host. And I'm talking about all about depression. How do you find motivation when you're depressed and just getting out of bed feels hard? Don't wait for motivation. Motivation is highly overrated. You don't wait for anything. Motivation is overrated. If you wait for your motivation, you're going to stay in bed all day. What you do is you make a commitment that whether you feel good or you feel bad, you get the hell out of bed and you get up and you do it. When you do that, all kinds of neurochemistry starts working in your brain, and you go, oh, I feel better because I did it. I work out 5 days a week. I never say, oh, I'm so excited, I'm going to go to work and go to work out. I do it. And when I'm there, it's wonderful. And it's wonderful when I finish. But I also do the workouts that I like. Don't do workouts that you don't like. If you hate swimming, don't swim. If you hate running, don't run. Find what works for you. Your body's telling you what works for me is burst training, power walks. That's what works for me. So for you, it has to be whatever it is. But don't ever wait for motivation, because motivation is not going to knock at your door. You create the condition that then brings up the serotonin and other things by your actions. How did the pandemic affect the general population? Well, a lot of people got depressed because they had to go into the cave, and they lost the rituals that they had with other people at work and so forth. But now, as you come out of the cave, then make sure that you don't go back to the things you didn't need when you were out of the cave. Make sure that you're not wasting the time that you were wasting now when you go into the cave. If you use it right, when you go into, when I say the cave, going in because of COVID or whatever, it's actually very good for you, because you learn to reflect, you get away from social media, you find out what you need, who you are, what's important in life, and that's really very important. Exactly what works for you, Pilates. Pilates is really good. Any kind of exercise increases endorphins, increases serotonin, muscle tone, reduction of pain. So it's really very good. And Pilates is actually very good. Most exercises are very good that keep you moving. Movement is very important for depression, but always with your professional help. Don't try to do it on your own. I'm not diagnosing here, nor doing psychotherapy. I'm just giving you general ideas for you to work out with your professionals or with yourself if you're planning to work with yourself. If you just joined, follow the host like IMO, Lemo or IMO 431. Make sure that you follow the host and then share and let people know about House Shrink. If you just joined, I'm talking about depression, all about depression. And then tomorrow you'll be able to see all of this in my channel, the Mind Body, in my channel, which is about Mind Body Code. And the name of the channel on YouTube is Dr. Mario Martinez. Okay, I'm going to get up and go for a walk. Beautiful. Don't wait for motivation. You get up, and when you get up, I promise you that after you do it, you're going to say, oh, I have control over my life. I did it, and I didn't wait to feel good about it. If you wait to feel good, forget it. You'll stay in bed for a year. Don't do that. 20-minute walks, I hear, are great. They're very good. 20 to 30-minute walks are wonderful. Even if you do it just 3 times a week, it's really very good. I walk 3 times a week. I do anywhere from 2 miles to 8 miles, depending. And then I do weight training and other kinds of things. So you need weight training to keep your muscles. Running is not going to give you muscles. Walking is not going to give you muscles. And you need a certain amount of muscles that you do with weight training. Actually, weight training is good for hypertension if you don't have complicated hypertension, for essential hypertension. So anyway, you reverse your diabetes sometimes. You can reverse diabetes just by diets. I mean, imagine if you're eating junk for 10 years, you're going to be screwing up your adrenal glands and other kinds of areas of the liver and so forth. If you stop putting junk into your body, your body has a tremendous ability to heal. The brain is very plastic. The brain can heal. The body can heal. But always do it with professional advice, because they're the experts. That's the kind of thing that you need to be aware of. So if you just joined, the first thing, the ticket is follow the host. Share and let people know that you're doing this. And then tomorrow you can see the whole video here on my YouTube channel, Dr. Mario Martinez. Also, when you go to my page, House Shrink, here, you'll see my 2 books. A lot of the things that I talk about here are extensively covered in the book, and it's the Mind Body Code and the Mind Body Self. I drink a hot lemon tea every morning. That's really very good. It does help with, it detoxifies the liver, and it settles your stomach. It helps with bowel movement. It's really very good. Hot tea with hot water with lemon, very, very good. I do that almost every day. It's really very good. Okay, Daniel, just follow the host. Wonderful. Anybody that comes in, please follow the host, because that's the most important way for you to stay in touch with me and for me to reach more people. It's very important. When I get to 10,000, I'll be able to do even more for you. There'll be more opportunities and more things that I can do. Now I'm up where I'm allowed to do, for example, a streaming for an hour or more, where before I couldn't. Let's see. The best I have found because he is so comprehensive and real. Oh, thank you. It's very nice. I appreciate that. I try to be real. No, I don't try. I am real because that's the only way to be. I can't BS you here. I want to be who I am. And if I know something, I tell you that I know it. And if I don't, I'll look it up. But the idea is that I have tremendous expertise in my work. I'm good at what I do because I put the time and the effort and the passion in what I do. So if I can share some information with you, then wonderful. I'll share the live video. Very well. Let's see. I know all the things I should and want to do, but I always forget. No, you don't forget. You choose to forget. Tell yourself, I'm going to be responsible now. You choose to forget, and you choose to forget because you're not loving yourself enough. Self-esteem is down. Go to my video on self-esteem, the 3 pillars of self-esteem, and you'll see what I'm talking about. There are many depression groups on Facebook. You can reach a large audience there that can help others. Yeah, of course. And here we have this is what I call our subcultural wellness. Here we connect with people and we respect people. We get the clowns out. It's been really good. The clowns have been, when they get the first clown notice, then they stop. So it's very good. And you see how nice it is because then you're able to actually hear some things that are going to be helpful to you. You're not out there watching stupid things that are going on. You're getting something that works. Make a calendar, put it on your fridge, set your alarm on your phone for your health. That's a really good idea. Yeah. Anything that you can do to remind yourself for self-caring is good. You can only be born. Nobody can be born for you. You can only have pain that nobody can have for you, and you can only die. Nobody can die for you. So what that means is that you have to start taking care of yourself. It's your temple. Don't put crap into your temple. It's like a car. You put bad fuel, you want it to run well? No. Let's see. Folks think breathing exercise, meditation, walks, cycle, or any of those things are good. Meditation, breathing exercises, walks, cycling, anything that gives you movement or that allows you to introspect and go into yourself is really good. Yeah, you got to do it. That's right. Sexy Sasha, you have to do it. You blame everyone. You don't blame anybody. Don't blame anybody yourself. Just do it. It's very simple. Just do it. My brother-in-law doesn't allow anybody to help him. Well, that's his choice. He doesn't want help. That's his choice. You can't save the world. You can only help people that want help. How do you help? The only way that you can help is by example. You live the example that you want to teach him, and it's his choice to accept it or not. To accept it or not. That's it. You can't fix people that don't want to be fixed. So don't fix the world. Fix yourself first. And then let the world watch you by example. If you're living a good life, you're an example of a good life. But don't try to sell it to other people who don't want it because it's their choice. It's their will, their agency. Take care of you and don't worry about others. You don't even have to worry. All you do is that you say, I'm going to take care of myself. And by taking care of myself, I'm giving people an opportunity of what it could be like to take care of yourself. So anyway, a lot of questions here, but make sure that you follow the host. First thing that needs to happen, follow the host. So I can expand the audience, I can do more things for you with a larger audience, and by the way, then you'll be able to know when I'm on. He asks for help and then rejects it. He's toxic. Yeah, what people do is they ask for help so then they can reject you. It's a way of toxic control. Help me. Okay, what about that? No, that's not going to work. What? No, that's not going to work. If he asks for help, say, hey, look, watch me. If you want to learn something, watch the way I do things and let it go. And he'll stop. Or he'll get upset with you, which means that if he gets upset with you, you're doing the right thing. Okay. Many people are joining and following the host, which is what I'm asking you to do. Music to my ears when I see, or music to my eyes when I see follow the host. Because I reach a larger audience, you're able to know when I'm on, and you'll be able to then also go the next day to my YouTube channel, Dr. Mario Martinez, and see the whole thing. If you just joined, I'm talking all about depression. And I've been talking about depression, but I've been talking about food and all the myths that people talk about depression. I'm bringing it into a science and talking to you about what is a clinical depression, what is a situational depression, and so forth. So After you follow the host, if you have any questions, do you feel that Dr. Phil is qualified to give advice? He's a psychologist. It depends on whether the advice that he's giving. If somebody says, I have this kind of problem, and he says, well, you got to do this and this and this, that's not good, because you have to know the clinical history of the person. You can give general ideas, and you can give, like I'm doing here, I'm giving you general ideas and so forth, but I'm not telling you do this and this and this as if I knew your history. I don't know your history. If you talk about bad food, yeah, I can tell you, yeah, bad food's not good for you. But how do you climb out of the funk of depression and just do it? Again, you get professional help if you need it. Very important. But one of the things about depression that I mentioned earlier is that depression you cannot wait for motivation to do anything. You create what I call a Spartan mindset, a Spartan consciousness. You get up in the morning, rain or shine, you get up in the morning, you get dressed, you do whatever you need to do. And then the thoughts, oh, I don't want to do it, oh, I'm tired, do it. And gradually what will happen, that movement, that commitment, that self-caring will begin to help you. And movement and commitment will help you with depression, but also you need professional help. Anyway, the first thing to do is to follow the host, which you're doing. And then if you want to see this video tomorrow, it'll be up. And the title is all about depression. And I'll be talking about that. And my YouTube channel is Dr. Mario Martinez. Nothing happens without motion. That's right. If you stay in your head, imagine all the inventors, if they hadn't done anything, how many inventions would we have? So it's very important. Let's see. So sometimes you need medication, sometimes you don't, but only your professional mental health provider can actually determine that with you. But you also question everything. What is the side effects? How is this going to work? Be an informed consumer, and then talk it over with your doctor, and what you both decide is what you do. If it doesn't work for you, you go to your doctor and you talk about it. You don't like that doctor, you go to another doctor. Motivate yourself, then stay dedicated. You cannot motivate yourself. Forget about motivation. Motivation is a manipulation. You can't, oh, if I do this and forget motivation. Even when I work with organizations, I tell them, forget motivation. That's rat psychology. Motivation is giving you something for you to do that you really don't want to do. Inspiration and movement is what works. Inspiration and movement. Monique, in Alaska, it's very strong, suggested to take vitamin D. It depends if you need it, yeah. If in Alaska, you probably don't get as much sun, I would imagine, and you have short days. But make sure that you check your blood levels with professionals to see if I have a vitamin D deficiency. And if you do, and you have to take it, what most nutritionists recommend is the D3, which is the best that it absorbs. But that's something that needs to be decided with your professional provider. Commitment to one's own wellness is first. Absolutely. No question about that. Get blood work done. But also there are a lot of foods that have vitamin D. So it's very important that you find out the foods that you need. And as I mentioned earlier, it's better to get the vitamins in the food than to take the vitamins, because the body can absorb the vitamins in the food much better than taking a vitamin. But if you're not, for example, absorbing the vitamins very well, you might need some supplements, but always with the decision between you and your professional. Maybe just stay simple and eat the right stuff. Yeah, that helps. But eating the right stuff is not enough. You have to work out. You have to do some meditation. For example, I've talked about this before, but if you spend 20 minutes a day, you're going to find some incredible differences here. 10 minutes in the morning before you get up, you do a meditation and you dump the dreams and everything is coming on. You watch it like clouds. Then what you're doing is you're not taking the garbage from the dreams into the day. Before you go to sleep, you do another meditation, you sit comfortably. I have some videos that I show you how to do it in my books. And then you do a meditation so you don't dump the day into the dreams. By doing that, you're going to be cleaning the pollution of thoughts. And you're going to find that you're going to be sleeping a lot better, and you're going to be doing a lot better. I lost 35 pounds in 3 months. Well, great. Uh, okay, sure, exercise and meditation. I do the body walk in the morning. That's excellent. Excellent. It's really very good. MAO inhibitors. MAO inhibitors, again, that's a decision that needs to be made as an antidepressant that needs to be made with your psychiatrist or your physician that you're working with, because it depends on your clinical history. Some people do well with MAO, some don't, and you have to decide with your professional. So I couldn't really give you specific advice because I don't know your condition, and this has to be discussed with your psychiatrist or physician that you work with. What's your take on HTP5 for the heart? For some people it's good, for some people it's not. Again, you have to check it out and find out if you need it. Talk to professionals, find out if you need it. Sometimes it doesn't work well for other people, and for others it's wonderful. It's very specific. This is why I try not to generalize and give you, yeah, this is good, this is bad. It depends on you, your condition, and how your professional understands what's going on with you. So it's very important. I'm being conservative and cautious here, so I don't give you some snake oil kind of thing that a lot of people do. I have to respect you as an individual and give you things that I consider to be cogent and good science. When you're trying to sleep, when you're trying to sleep, what about it? Let's see, Mary Koger, what are you trying to say when you're trying to sleep? Because I missed that part there. If you just join, I'm talking all about depression, and let's see, meditation or breathing exercise or start. If it doesn't work, contact a therapist. Yes, that's what I'm saying, that meditation, breathing exercise is really good, but they do work to a certain degree. And if you need more, then you can go to a professional, and your professional will help you. What is your husband is asking certain stuff? Tell me what your husband is asking and see if I can answer it. Work out a little 2 hours before bed, and it will be better. For some people, working out before bed is good. For others, it's not. Be aware of this. Some people get hyperactive, and it doesn't help them. Some people, it does. What I would suggest, you practice it for a week and see how it works, and don't do it for a week and see how it works empirically. But it doesn't work for everybody. Explain how sunlight helps with depression. Well, the theory is that in some of the clinical work that melatonin, which is a neurotransmitter hormone, affects your moods. And if you don't get enough in the sunlight, your brain will not secrete enough of the melatonin, and it could cause depression, especially what they call SAD or seasonal affective disorder. And the thinking is that if you get more light, and there are some lamps actually that have that kind of light, it increases your affect and improves your affect. So it depends on the individual and where you live. For example, places like it was mentioned earlier, in Alaska, you don't get as much light. You might have could be a combination of deficiency of vitamin D and melatonin. But then again, that needs to be looked into with your professional, whoever it is. Okay? All right. If you just joined, first thing to do, follow the host. And then tomorrow, you can also, speaking of hormones, can they cause depression, especially women over 40? What do you mean, the hormones that you're taking, or hormone changes in menopause? Let's see. Okay, let's see. Anyway, if you just joined, I'll see if I can answer the questions. It's all about depression. The first thing to do is follow the host. And then tomorrow, you can watch this whole video on my YouTube channel, which is Dr. Mario Martinez. Here is how shrink. And make sure that you follow the host, you share, and you let people know about this, because we want it to go just completely organic. I don't like to say viral, because that's not a good term. I think organic is a lot better. It's a lot healthier than... Okay. People that just joined, follow the host. And I'm talking about depression. I'm a clinical psychologist. House Shrink is my name here. And my real name is Dr. Mario Martinez. Okay. I'm not sure about that question, so I'll have to wait and see how this works out. So make sure that you follow the host. And also, there's I have a new feature here that is not being used as much. If you have a question that was not answered, you can go to my page on How Shrink, and there's at the bottom in red, there's Q&A. You go there, you ask the question, and what TikTok does is allows me to do a 15-second or 30-second video specifically to answer the question for you. And the wonderful thing about it is sometimes people will ask questions that are general, that other people, oh, I wish I could have asked that. So it's very helpful. So go there, Q&A, and ask questions if you want to, and I'll answer all your questions if I can. Hi, my intended major in psychology, but my family keeps telling me I'm going to have a hard time. Well, let me tell you, Presley, let me tell you my story that I've talked about before, but I'll tell you because it may apply to you. My grandfather was an inventor and became very, very wealthy with his invention. So when I was a little boy, my mother said, "You're going to be an engineer like your grandfather. He was a mechanical engineer." So when I was a kid, I would say, "Yeah, I'm going to be an engineer." Why? Because that's what I want to be. That's what they impose to you without me knowing it. So I thought, okay, I'm going to college. I'm going to do my engineering. Terrible, terrible. Failed all the courses. I hated them. Couldn't do it or didn't want to do it. I wasn't going to do that. So I came back home and I told my mother, I'm not going to do engineering. Forget it. That's not where my head is. And she said, okay, do anything you want except psychology. So that may answer your question. You have to live your life based on what your passion is, not what other people tell you your passion should be. Whatever you do, if you're good at it, you'll find a job. But you have to love it first. Steve Jobs always said you have to love what you do. That's where your creativity comes in. That's where your passion comes in and everything else. Don't look for passion. Look for creativity. What is your creativity about? That's what your passion is. When people say, find your passion, find your passion. What the hell is your passion? Look at where your creativity is. Look at what you do uniquely that's better than other people. That will bring you passion. Why accept psychology? Your mom say that because she knew that's what I wanted, and she would be disappointed if I. See, parents try to do things that are well-meaning, but they live their lives vicariously through you. My father was very good at sports, and I was terrible at baseball, and I disappointed him. Well, that's how it is. That's how you do it. But the key to it is that you have to find what it is that you do well, that you love doing well. And you will find that your passion will come out. And if you're good, no matter what happens, don't ever go into a profession. A lot of people have gone into nursing and hated it, not because it's bad, but because it wasn't for them. They'd say, okay, nursing is what's big right now, or an MBA is really big. I'm going to do it because that's what's going to get me a job. And you hate it, and you're miserable when you're doing it. And by the time you finish, it's not needed anymore. So you have to do what you think you want, try it, be good at it, and then find the people that need you. Anger and fear, to me, are closely related to each other. They are, yeah. Anger and fear are related. For example, when people are angry about a race or about a sexual preference, it's really a fear of knowing that person. A fear of maybe that person hurting you because they're from another race or because they have another sexual preference. So fear and anger are very related. And a lot of times fear is a kind of a mask of your anger. Sometimes depression can have a mask of anger. A lot of times depression, people are angry with themselves or with others and they can't express it, so they take it inward and they get depressed. I hated my old job. I love organizing, and that's what I do now. Exactly. Don't stay in a job that you hate, but don't be foolish and say I'm going to quit tomorrow. Don't do that. Give yourself time to find what you like while you're getting paid for it and while you're doing your work. You're getting paid for it. It's like a stipend for you to find yourself. That's the way I look at it when you don't like your job. Not all people who have fear have anger. No, that's true. But they're interrelated. They're interrelated. Sometimes you have a fear. If you have a fear of a snake, you're not going to be angry at a snake. But if you have fear of your father, it might be because you're angry with your father and you can't express it, so you're afraid to express your anger. So they're interrelated, but they're not always connected. Can you describe the connection between anxiety and depression? Yes. Sometimes you can have depression with anxiety, or you can have anxiety without depression. A lot of people think, well, depressed people don't have any, they have no energy. It's true, but depressed people usually have a higher cortisol level, which means that they're the higher levels of stress going on. And sometimes they feel an anxiety, and sometimes they can't even identify the anxiety because it's covered by the depression. They're not the same, but they can be interrelated, and you can have both, one or the other. Fear of the unknown, well, you were taught fear of the unknown. You know why? Because most likely, fear of the unknown is that you're afraid that you're going to make a mistake, or you're afraid you're not going to be able to handle the situation. The best way to deal with the future, you can't predict the future. You become very good at your creativity, and then you trust your creativity to go into the future. Have faith in your creativity, and you can develop it. Fear equals grab the bull by the horn. Sometimes, but if the bull is charging, you don't want to do that. You want to find out what it is, under what conditions, who taught you, and how to change it gradually. Because if you have a phobia of heights and you go to the 10th floor, it's going to get worse. So you have to be careful how you do it. You have to get help, but do it gradually so your nervous system can adjust and desensitize itself to it. So I wouldn't say the bull by the horn in all cases. In some cases, it's good, but you have to be aware of what's going on. Sometimes it could get worse if you overreact and overdo. Okay, we're coming close to the end, and I want to thank everybody. And the first thing to do, if you haven't done it yet, is to follow the host. And it's all about depression. What is your education and training? I'm a clinical psychologist. My doctorate is in clinical psychology. I am a trained neuropsychologist, licensed in psychology, postdoctoral work in psychopharmacology, and many years of private practice with the depression, addictions, PTSD, autoimmune illnesses. So that's schools, Vanderbilt University, the University of Madrid, and the postdoctoral at Fairleigh Dickinson. So anyway, that's my background. So thank you very much for joining. And if you haven't followed, please follow before you leave. And you'll be able to see this tomorrow on my YouTube channel, Dr. Mario Martinez. So follow here. And if you're already following, then share. And make sure that you follow also on my YouTube, Dr. Mario Martinez. Read my books, The Mind Body Code, The Mind Body Self, and I have hundreds of videos here as well as on YouTube, completely free. So enjoy and have a wonderful day. And before you go, make sure that you follow the host. Thank you, and I will see you soon. And by the way, the clown warning really worked well. It's very good. We had very few. So it was a great idea. All right. Thank you, friends. See you soon. Enjoy.